Okay, so first, I just wanted to briefly introduce the National Poll and Healthy Aging team, and research is always a team sport. We do it to the nth degree in the National Poll and Healthy Aging. We have a really outstanding team that I am privileged to lead, and that includes Erica Solway, who's our deputy director, who many of you may know, Scott Roberts, our associate director from the School of Public Health at University of Michigan, Preeti Milani, the previous director of the poll, who also was the chief health officer of the University of Michigan for a number of years before taking on a very important editorial role at the JAMA journals focused on diversity, equity, and inclusion. Diane Singer, who makes all the trains run on time as our really experienced poll manager, and Matthias Kirch, who is our outstanding data analyst, leading all of the analyses that I'll be sharing with you today. We're also surrounded by a really expert communications team who is so critically important in making sure that we share our findings in all kinds of different communications channels where they're going to get noticed by the media, by policymakers, by fellow researchers and other academic stakeholders, anybody that could be contributing to solutions to promote more healthy aging, we want to be getting the word out to. And they are really expert at making that happen and helping us think about strategy. So how do we do the National Poll on Healthy Aging? And, I think we've all focused a lot more on polling data in recent years. If we rewind back to probably 2015, 2016, and we think about political polling and everything that was going on at that time and how some polls pointed towards certain trends and some polls maybe led us astray and weren't great measures of what was going on out in the broader population. We think very carefully about the methods that we use in the National Poll on Healthy Aging to ensure that the estimates that we generate are as rigorous and are as valid and reliable as possible. And the way that we do that is we, in our early years, partnered with Ipsos Knowledge Panel. And so this is a large survey research firm that some of you may be familiar with, does a variety of work around polling and public opinion polling, but also market research and all kinds of survey research approaches. The National Poll on Healthy Aging is 5 years old now. We just celebrated our 5th birthday this past fall. And we transitioned in recent years away from Ipsos and towards Ipsos were tremendous partners with us for a number of years. For a variety of reasons, we've now transitioned to NORC Amerispeak. So this is the National Opinion Research Center out of the University of Chicago. And we rely on their Amerispeak panel, which is a very large panel survey comprised of adults, including older adults and younger adults from all across the nation. And we administer, using NORC's Amerispeak panel, we administer our surveys as part of the National Poll on Healthy Aging to them twice a year. So this goes out to about 2,000 people who are age 50 to 80. And the sample then is the way that NORC recruits for their panel, and then the way that we are able to understand, who's actually completing the survey, who's likely to respond, who's less likely to respond. Are we ensuring that we are generating a nationally representative sample? NORC is really outstanding at generating very accurate weights that allow us then to make estimates that are representative of the broader U.S. population of U.S. adults age 50 to 80. Related to that, our completion rates are very high. There's 60 to 70% among those who are contacted to participate in the survey. So that also helps us be very confident in the national representativeness of our estimates. Importantly, the surveys are completed both online and by telephone. Historically, when we were using Ipsos, that was entirely an internet panel survey. And Ipsos does a tremendous job ensuring that that does not bias the survey results, so that people who are contacted to participate in the knowledge panel that Ipsos houses, that they're given a computer if they don't have a computer to complete surveys. They're given broadband access if they don't have broadband in their community or in their home. Yet you could also imagine situations in which that might not quite be enough still to ensure that we are being as inclusive as possible in our data collection. And so one thing that NORC does very, very well is that for the many older adults who are comfortable completing online surveys, they can complete surveys through those mechanisms. For those who are not comfortable completing online surveys, those surveys are then completed by telephone, and then they have ways and the weighting of the data and other things that they do that ensure that we're able to take into account some of those mode effects in data collection. Okay, so wanted to really spend some time explaining how we go about collecting data as part of the National Poll on Healthy Aging before I share some of the results that we have related to loneliness. So we've done a polling on a number of topics over the years. We've done over 50 monthly reports as part of the National Poll on Healthy Aging. Here you can see some of the varied topics that we have done polling on in the recent, probably last 1 or 2 years. Things related to mobile health app use, decision-making about surgery, preparedness to age in place, a focus on women's health, use of and interest in integrative medicine strategies, especially for pain management and mindfulness and other aspects of health and healthcare, arthritis and joint pain. So this is just kind of a sampling of some of the many topics we've done polling on recently. This work has been covered widely, and these are but some of the places where our results routinely show up in the media. If you are interested in getting our monthly reports in your email inbox, you can do that by going to healthyagingpoll.org. You can also find there that poll data are actually available for free download and use. We hold on to some of the data for a brief period of time because we work with academic partners at the University of Michigan through our Institute for Healthcare Policy and Innovation. So we work with people who are experts in each of the areas where we do polling. So we take some time to do all kinds of analyses on those data and often have academic products that come out of that work. But we also want to make our data broadly available to the health and healthcare community. And so and we try to do that in as timely a manner as possible. So if that's something that may be of interest to you or your organization or other people you work with, please go to that website and peruse some of the data that we have available. And hopefully that would be of interest to you and your colleagues. So turning then to loneliness. Loneliness is an issue that we have been doing polling on way back since 2018. And in just a second, we'll look at some of the trends around some of the data that we've collected. But these are data from the very first time that we collected information on feelings of loneliness among U.S. adults aged 50 to 80. And these were data that we collected in 2018. And loneliness is one of those interesting constructs where you talk to different people about loneliness and they may have different ways of measuring that or operationalizing that. If you talk, for example, to especially different social science disciplines, whether they be sociologists or psychologists or geriatricians, people from looking at it through different lenses. Some people might think of it as a lack of companionship. Some people may say feelings of isolation. Other people may say, how often do you just have contact with other people? And so we've looked at it through different lenses over the years, as I'll show in a moment. But back in 2018, we were just very struck by, at that time, just how frequent among older adults were feelings of a lack of companionship experienced by about a third of older U.S. adults, and feelings of isolation experienced by just over a quarter of those individuals. Now, if we fast forward slightly to March to June 2020, so we can all remember what was going on at that time, all of the national shutdowns going on because of the COVID-19 pandemic, and a lot of social isolation. Unfortunately, much of that occurring intentionally so as to reduce the risk of spread of COVID-19, and especially its very serious health impacts on many older adults. You can see here the changes from October 2018 when we first collected data, and then what we found in March to June of 2020. So we saw a slight increase in feelings of a lack of companionship. We saw a doubling of feelings of being isolated from others. And then we saw a substantial increase of having infrequent social contact with other people. So very serious increases in feelings of loneliness, again, looking at it through different lenses from October of 2018 to March to June of 2020. Now, if we stick with that October 2018 measure, and then we fast forward even more to July of 2022, so we're now moving ahead about 2 years. And so this is looking back at last summer. And as we think about all kind of the ebbs and flows of COVID-19 spread, of what was going on with different public health directives in different communities around the country, we can think about kind of what was going on at that time. There's an opening of a lot more of a lessening of some of the restrictions around isolation. Still a lot of concern about spread of COVID-19. Still, some people choosing to isolate themselves. And so we saw then a decrease in a lot of those numbers in terms of a feeling of lack of companionship, again, as compared with March to June of 2020, a decrease in feelings of isolation from other people, and a decrease in infrequent social contact. But I think the most important point here is these numbers were still higher than they were as compared with October 2018. Now, we collected data earlier this year, so in January of 2023. And so if we just look at our measure of feelings of social isolation, you can see here, this is probably the most important slide that I'll show you, which is the trend on this particular measure from October of 2018 to January of 2023. And we've seen similar trends in all the different ways that we've looked at loneliness, where we see a big spike in June 2020, and then a continued slow decline as we've gone into January 2023, when we most recently collect data on these measures of loneliness. But yet, these numbers still remain higher than they were in October 2018. And one other point that I failed to mention, but I should have from the very outset, I think all of us can agree that the data, what we measured in October 2018, whether it be social isolation, whether it be lack of companionship, all of those numbers were unacceptably high already in October 2018. And so the numbers here are still higher than they were at that time. They have improved, but they were unacceptably high even before the COVID-19 pandemic, and they remain worse than they were at that time. It's also very important to note that, I'll come back to this in a second, that, I think the work of the Surgeon General, Dr. Vivek Murthy, and others who, including many of your organizations and many of your colleagues who are drawing more and more attention to this critically important issue. Loneliness is a problem that is pervasive within our society, and it is unacceptably high for every age group. And I know here we are talking about, especially among older adults, and it has its own unique health consequences within that population. Yet this is a broader social problem in America and many other countries. And so, these numbers also are unacceptably high for other age groups too. Now, how does that then relate to health outcomes for older adults? So what we have found, if we rewind all the way to 2018 and we look at our data from every time we have measured how common feelings of loneliness are among older adults, we have found several factors being consistently associated with loneliness. Now, we talk about associations because every one of the polls that we conduct is a point-in-time snapshot. So, by way of research jargon, these are serial cross-sections. And so we collect point-in-time data. Now, sometimes we'll say, okay, looking back over the previous 12 months, how much did this change for you? And so we can get at some of the kind of the temporality in some of these measures. But we do, in most cases, have to talk about associations here. And so it's important to note that, we see a lot of things traveling together, and sometimes we have insights about what may have been causing what, but it is often difficult for us to definitively point to causality around some of these relationships. Now, that being said, we have found many factors being consistently associated with loneliness over the years. For example, consistently, older adults who are in fair or poor mental health consistently experience higher feelings of loneliness in every one of the measures that we look at. We can say the same thing for older adults who are in fair or poor physical health. And it's not just a small, weak association. It's often a strong one where we see substantially higher feelings of loneliness among these age groups. We also find among older adults who have a health problem or a disability that limits their daily activities, having substantially higher rates of loneliness than older adults who do not have those health challenges. Now, another important consequence that we are continuing, so one thing we're continuing to do then over time is in almost every one of the polls that we conduct, and again, we collect our data about twice a year, and then we have different modules that occur within each of those poll fieldings. So we might do polling on 3, 4, 5 different health topics twice a year. And then we have a common set of questions that we ask about within those polls. And so we may have things around, for example, health status, chronic conditions. One thing that we have now added into our standard set of items that we do polling about, no matter what other topics we may be polling on, is loneliness. And so we're able then to look at associations between feelings of loneliness and other health issues. And one really important example of that is a poll that we conducted in June and July of 2021. So again, this is like, about a year or so after the start of the COVID-19 pandemic, because this is when we released our report. And I think that these data we had collected certainly at some point earlier in 2021. I don't remember exactly when, but it was around a year or so after the start of the COVID-19 pandemic, when there started to be increasing attention to things like alcohol consumption in the broader adult population, including among older adults. And one really important thing that we found among older adults as it relates to loneliness is that feelings of loneliness were associated with changes in alcohol use during the pandemic. So specifically, older adults who reported a lack of companionship some of the time or often in the past year were more likely to say they increased their alcohol use during the pandemic. So not only do we look at those who may be at greater risk for feelings of loneliness, but we're also starting to understand better what might be some of the health consequences of feelings of loneliness, because those relationships, again, can run both ways. So health issues causing loneliness and then loneliness causing other health problems. So the main takeaways from the data that we've collected thus far are that loneliness is common among older adults. And it preceded the COVID-19 pandemic, and it remains so to this day. So specifically since the height of the COVID-19 pandemic, loneliness has indeed declined, and that's a good thing. But it unfortunately remains unacceptably high in this population. And we have learned from our data that, again, with the caveats being that from the way that we collect our data, it can be difficult to ascribe causality to those relationships. But I think we can, one reasonable interpretation from our data is that health problems can indeed be both a cause and a consequence of loneliness among older adults. So what then, given what we found, what can we do about loneliness? I think that's where it's far easier to collect data on this problem than it is for us to point to obvious policy solutions. But that's where we are. And all of us are obviously here working together, caring deeply about this issue and figuring out what we can be doing to address this really critically important public health problem among older adults. Well, I think all of us would agree we need a really multifaceted approach. And every stakeholder group, every sector that touches on the health and well-being of older adults, I think needs to be part of the solution. A really important part of that is awareness raising. And I think that must continue. Again, I really want to applaud, and I'm very grateful for the work of Dr. Murthy as Surgeon General for what he's done to draw attention to this issue. And I think we all need to continue to be raising more awareness about this problem. That really struck home for me when the awareness raising around loneliness trickled down to my father, who you can see here with my kids from about a year ago. And, he's a retired Air Force veteran who is 83, living alone by himself about 2 hours north of Ann Arbor, and with metastatic throat cancer. And he saw something in the news or read something in the newspaper about loneliness. And he brought up to me and my sister the other day, what do you think about this? And he's a fairly stoic man. And his way of bringing up, what do you think about this, was his way of saying that this is something he was struggling with. And I think it's important to raise awareness about this issue for a number of reasons. One of them being helping many older adults understand that they are not alone, that loneliness is very common. And because it can be, I think, isolating in and of itself, and can kind of entrench that when you think, gee, I'm feeling lonely and maybe I'm the only one of my peers maybe to feel it, or other people don't feel this way, or older adults socializing with others, et cetera. And so so I think that it's really important for older adults to realize that they're not alone in feeling in having feelings of loneliness. I think clinicians, I'm a primary care physician. I'm going to be seeing patients at the Ann Arbor VA this afternoon. We're a part of the solution because we should be identifying and screening older adults at increased risk of loneliness and figuring out the most efficient ways to do that. Referrals to area agencies on aging and other community resources like senior centers, I think, is critically important to provide resources and support to older adults who may be experiencing feelings of loneliness, especially those that may have more difficulty connecting with those resources. And I think as part of the awareness raising, we need to really be encouraging family and friends to connect, check in and reconnect with older friends and neighbors, especially with those who they may have become more disconnected with in recent years, as again, we all kind of continue to evolve from the COVID-19 pandemic. Again, if you want to learn more about the National Poll on Healthy Aging, please visit our website at healthyagingpoll.org. We are a signature initiative that the University of Michigan Institute for Healthcare Policy and Innovation. So there's a lot of related work that may be of interest to you and your colleagues. If you're not already aware of it, again, you can sign up to receive our reports by email. And our findings from the poll routinely come out through the IHPI's Twitter handle, which you can see here at the bottom of the screen. And if we can ever be a resource to you and your colleagues, please do not hesitate to contact us by email at healthyaging@umich.edu.